Great. So, hello everyone. My name is Karishma Chandak. I'm an NLP practitioner and consultant from Surat, India. Firstly, a very warm welcome to one and all present in this live webinar today. Anxiety, mood shift, disorders, depression, mental state, mental health, mental fitness are few very frequently used words in this pandemic year 2020. The 10th October marks this year's World Mental Health Day, and what a year it has been. Challenges faced due to the upheaval of normality from the COVID-19 pandemic has highlighted more than ever to the world the importance of mental health and well-being globally, as mental ill health has become increasingly more prevalent and widespread during this time. And today, Indian Medical Association, IMA Surat, India, Association of Physicians of Gujarat, APG India, Associations of Physicians of Surat, APS India, and Association of Indian Physicians of North Ohio, AIPNO-USA, we have organized this Need of the Hour webinar on instant ease from the mental disease by Rajyogini, Dr. Sunita Didi because mental health matters. So before going ahead, a small note for all the viewers and audience that if you have any questions, you can write in the YouTube chat box and we will take up those questions at the end of the webinar. And now, without doing a further ado, I would like to call Dr. Mita Paswala, President APS India. She is MD by profession and a full-time physician at Lokhat and Mullah Sarvajanik Hospital since 23 years. Through her profound knowledge and experience, she has conducted several workshops and contributed in the field of teaching as well. I feel really glad to welcome you, ma'am. Dr. Mita Paswala. Ma'am, your voice is not audible.
Dr. Mita, madam, we are not able to listen to you, please.
Ma'am, can you try reconnecting your audio? We are able to see you, but we are not able to hear you.
Please unmute yourself, Dr. Mita, madam. Dr. Mita, please unmute yourself.
I've asked
yes,
you to
muted
yes.
herself. Yes.
Yes.
Now you may please speak. Dr. Mita Ben, you may please speak. It was not audible earlier.
Host has unmuted, I guess.
No, she is unmuted.
Yes, she's unmuted.
डॉक्टर मीता बेन आपकी आवाज नहीं आ रही है. आप वो हाँ ईयरफोन लगाइए आपके. Earlier, your voice was very much audible. What happened now? Okay, so I think let's go ahead.
Yes. Yes. So we're so sorry for the technical glitch here. So let us move ahead. Now I would like to call Dr. Hiral Shah, President, Indian Medical Association, Surat, India, to throw some light on today's webinar and give us some insightful notes over her excellence and experience. Dr. Hiral Shah, please.
Please unmute him, host. Please unmute yourself. Yeah.
Am I audible now?
Yes, you are audible, sir. Yes.
Thank you very much. Good evening, everyone. Am I audible?
Yes,
sir. Yes, you're audible.
Yes. Thank you. On the occasion of the 10th October, World Mental Health Day, it is a very interesting and very inspiring topic. And the seminar or session, I can say, thank you very much, Sunita Didi, along with our own Mita Ben, Dhiren Bhai, Dr. Amit Mohan, Dr. Rupesh, Dr. Dharmesh Bhai, Dr. Kala Didi. It's a nice and pleasure for us to join on this occasion. Not only such a physical health is important, but considering the scenario of the current situation of COVID, the whole world is going through a stress. And such a sessions, I think every weekly or fortnightly, it has to be organized on one or other platform. Really, it's very pleasing moment for me to join on this occasion. Once again, warm welcome to all. Thank you very much.
Thank you so much, sir. Thank you so much. Next, I'm going to introduce a persona who is so close to the area of mental health and who treats and deals with mental illness patients on daily basis. Dr. Amit Mohan is a psychiatrist and executive director at ARC Psychiatry. He's working as a staff psychiatrist at various hospitals and has been a crucial part of many conferences and academic societies. I feel honored to welcome you here, sir, and we would like to listen from you.
Can everybody hear me? All right.
Hello, sir. Hello, sir.
Can you hear me?
Yes.
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 All right, good. Thank you, everyone, for having me here today on this big day, especially, working as a psychiatrist. I want to start with the first, thank you and hello, everyone. Om Shanti, Namaskar, my esteemed colleagues, brothers and sisters who have joined us today on this big day and supporting the cause of mental health. I'm really pleased that I was given this opportunity to be here on behalf of the Executive Committee of Association of Indian Physicians of Northern Ohio, AIPNO. It's a non-for-profit organization which is in its 38th year now and has more than 600 members. The association and its members have taken lead in improving access to the quality health care, especially focusing on needs of underserved people here in the US and in India. And I'm very pleased that I could be a part of the executive committee. We have organized a lot of volunteer work. We are working in a lot of education for our next generation as well. I want to give my special thanks to Dr. Raina, who is our president and who has given me this opportunity to represent our organization. Today, I'm here not only as a practicing psychiatrist, but also due to the fact that this field is very close to my heart. Seeing my own family members and friends struggle started my journey into mental health and where I am today. It made me, this has become like a work of my life. And working, removing stigma associated with this field and bringing the ray of hope for a lot of silent sufferers has brought me here where I am. I have been practicing in the field for 14 years now with a special focus on mind-body connection. Because what I feel is like, if the mind and body are not connected, there's no balance and one feeds into each other and we cannot feed, our body or our physical needs without taking care of our mental health needs. And especially with this COVID pandemic time, mental health has become a big challenge, not only due to increased number of people struggling with depression and anxiety, but also access has decreased. And I think by doing these things, by creating these webinars and every little step that we take in educating and helping people, we're playing a big role in easing the distress in the lives of a number of people. I always urge people to seek help as a better present and future exists for all of us. And it's our right to feel better and enjoy life in its entirety. So without further ado, I'll pass on to our keynote speaker for tonight, Dr. Sunita Didi. Thank you for having me here.
Great. Thank you so much, sir. Thank you. Yes, very rightly said by you that mental health is hard because people can't see it, so they don't get it. When it's skin rash, here is some cream. When it's broken leg, let me get you a cast. When it's depression, they say it's just a phase. Anxiety, it's all in your head. Doctor, you should go, and therapist, not necessary. So today we are here to break the stigma and find instant ease from mental disease by Dr. Rajyogini, Dr. Sunita Didi. Where do I start and where do I stop? Because justifying her work and excellence in few words is the most difficult thing to do. Rajyogini Sunita Didi has a powerful, clear, personal vision to bring silence, science, psychology, and spirituality together in the service of developing world sovereigns through self-sovereignty. Since 40 years, she is giving her valuable contribution in each and every field and has been awarded and recognized at various platforms nationally and internationally. I can go on and on with her introduction, but let's just experience the depth of her profound knowledge and wisdom by herself. Please welcome Dr. Sunita Didi.
Thank you. Thank you so much. A good evening to all those who are from India, and a very good morning to all those who are from USA. So today, on this World Mental Health Day, first of all, on behalf of Brahma Kumaris, I extend a happy World Mental Health Day. And the topic today is instant ease from mental dis-ease. So today we are staying in an instant world, and everything we want instantly. Instant coffee, instant noodles, instant medication, instant appointment, instant consultation, everything on the tip of our finger, everything in just one touch. One touch, and there's everything there instantly for us. And so, why not instant ease, instant positivity, instant happiness? For that, everybody says, oh, it's very, very difficult. Instant dis-ease, that's normal for everybody. Instant angry, to get instantly angry, to get instantly upset, that has become so very normal. But when we say that, oh, please, in an instant, become peaceful, there's the question now, how can we do it? And the latest India Today news is that about 1 billion people, they are living with mental disorders. About 3 million people, they die because of the harmful effects of alcohol. And about 1 person in every 40 seconds die by suicide. So World Mental Health Day should not be only celebrated on 10th October, but let us celebrate it every moment of our life. That yes, understand that the root cause of the dis-ease or the root cause of the diseases in the body is the dis-ease in the mind. And so, if from this ease of the mind, if we are at ease inside our mind, then that will also help us to increase the immunity system of our body. So let me give you instant tips, in short time that I have today for all of you. And those instant tips, the first one is breathe in and breathe out. This body, our physical system, has a very good system. And what is that system? That whatever we are eating, all types of good food we eat, that gets digested, and it has a system that once in a day, it has to let go of that also. And if not, if it fails to let go of that, the waste that it produces in the body, And if that waste is not let go out of the body, then there are going to be various diseases. So also the water, which is very, very important for our health. And it is something that quenches our thirst and is the healthiest drink that we can have. But then too, although it's very healthy drink, but yet if we retain a lot of water in the body, and if the system does not let it go out, then again, there will be diseases. Right? So how we wish that all the mental negative emotions also had that system in the mind, that they also automatically get, washed out from the mind, but it doesn't happen like that. We need to consciously choose to breathe out. Once what happened, a very matured lady who was teaching pranayam, she said to everybody, all the students in her class, she said, okay, everybody, now please breathe in and hold your breath. And everybody did that. And then after some time, she just went to sleep. And the students were sitting in the front, she was at the back, They were waiting for the madam to say, please breathe out, right? But, the time was going and there was nothing heard. So one of the students, they just looked at the madam, what is she doing? And she was sleeping. So that student went to madam and woke her up. And as soon as she woke up, she said, oh, please breathe out, Well, so if we only breathe in, and if we do not breathe out, what is going to happen, right? So also, whatever is there in the environment today, we are naturally breathing in that. We are breathing in the pollution, we are breathing in the negativity, right? But we need to actually breathe in what is healthy. Now, this is our choice. This is the choice that we need to make, that let us breathe in only positivity, only peace, only bliss, and let us breathe that in and let us breathe out that. Because if we breathe in the negative emotions, there's so much of negative information. And if we keep breathing in only negative, 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 and there's no system here mentally to, automatically let it out. And then if we do not have that power also to choose to let it out, even if we want to, let it out, but we are not having that power inside that we let it out, the negative emotions go away, and we only have positive emotions inside. So what is going to happen? All the other mental disorders, all the disease that are going to develop. So what is the instant tip is breathe in positivity so that you also breathe out positivity, because whatever you take in, you're going to give it out. Right? So we need to do that. And so the second instant tip to breathe in positivity, the second instant tip is step back and take a break. Very important. Because it's not in a life that, always that moving ahead, rushing ahead, going fast, that we achieve and accomplish everything. Sometimes, just like a game of chess, sometimes you need to take a step back too in order to win the game. So we also need to give this attention to step back, be your identity, be your original who you are, contemplate within in your inner world rather than being focused on the outer world, and see that your original identity is not this physical body alone, but it is the one who is ruling this physical body, which is here when we dissect from here and here, behind the pituitary gland, near the hypothalamus, there is an energy which is called as psyche in scientific terms. And in spiritual terminology, we call it as soul. So this is me, the soul, the beautiful entity here, which is imperishable entity. And the original quality of this soul is of peace. is of bliss, is of happiness. And when I am focused on this inner being, my original identity of who I am, then automatically I breathe in that peace and I breathe out that peace. So this is the second instant tip, to be your original identity rather than copying others, rather than seeing others, rather than entering into a competitive world, entering into a rat race. It's just when you are looking at others that all the negative emotions come. As soon as I am concentrated on myself, who I am, what is my self-talk, and when I give it a positive spin, automatically then I experience that instant ease within. And therefore, the third tip is never give up. Whatever may happen, never give up, because the referee has not yet blown his whistle. Why I'm saying this is because I recall a story of a small boy who was playing in his hometown. And in his game, there was another person who was watching this game when he was playing. And so he saw that, the small boy was playing with great enthusiasm, zeal, and very happy, very smilingly. And actually, his team was losing. They were on the score, his team score was 0, and the opponent team's score was 3. And when this person who was watching asked him, "Hey boy, how are you finding yourself? Why you're smiling and you are so happy? What makes you smile? So, do you know what the score is?" So then boy says, yes, that other team is leading us by 3 and we are at 0. I know. And he's still smiling. So this person who was watching was very astonished. So he said, "We are winning, you are losing, and yet you're smiling?" So he said, "Why to be astonished? Why to be discouraged?" Right? Because the referee has not yet blown the whistle. And I have full faith in my team leader that we will win. And it did happen like that. His faith won, and his team leader was very, very good at whatever they were playing at. And so their team won, and their team score was 5, and the opponent was 4. And this person who was watching was really astonished. And he said, "This little boy, he has so much of faith." And, they were losing, but he did not give up because of his faith in his leader. So also, we all are playing in this life game. And there are situations that come in front of us. There may be situations that are not as per as we want them to be. But then we have to remember the referee has not yet blown the whistle. And so we have our game leader, the supreme energy, who is there with us. Have faith in him. And that faith in that ultimate will give us the instant ease that we want. Why? Because that our leader, he is the Almighty. He's the ocean of peace, ocean of happiness, ocean of bliss. And just when we connect with him, our intellect connects with him, instantly we get his peace, his happiness, his love within us. Just like when you are sitting under the sun's rays instantly give you the heat and the light that you want. So also when we connect our intellect with the Supreme, who is the ocean of peace, ocean of love, ocean of bliss, instantly, our battery, our mind battery gets charged with his power, his peace. And there we gain that inner peace. Instantly we are at ease, and all the dis-ease in the mind is not gone away. So when there is no dis-ease here, no disturbance here, there is that stability here, and there is that peace here, then automatically that affects first our body. And so if there is any disease, it may be corona, it may be any other, but if here we have not entered that disease in our mind and we are at ease, then that will help to increase the immunity system and fight that disease with great ease. So these 3 tips, if we apply in our life, then instantly we will be at ease and we will be away from all the disease. So on World Mental Health Day, let us choose this healthy choice of instantly being ourselves who we are, take a step back, breathe in our original identity, and breathe out the same thing outside into the environment. And take a break throughout the day for one minute in every hour. And before going to sleep, make it an aim that we be ourselves, connect with the Supreme, and be at ease before going to sleep, because then that will give us a good sleep throughout and will energize our body as well as our mind for a very good, healthy morning. And if the morning is healthy and good, then the foundation is laid for the entire day again. So let us do few moments of practice of these 3 instant tips now itself. Please sit back with a smile on your face. Let us focus our mind on our identity in this body, in the center of the forehead, and visualize with our intellect a small, tiny, shining star. And create a thought: I am a star of peace. Just like a bird of peace, flying away from this cage, the body, I go beyond the sky into a golden red light realm where we all are shining like peaceful stars. And there we see the Almighty, our Supreme Father, who is the ocean of peace. And fill ourselves with His peace. Let us make a determined thought today that my real identity is to remain at ease, connected with my Supreme Father, and this is what I will be breathing in and breathing out. Breathe in the happiness and breathe out the happiness. Breathe in positivity and breathe out positivity. And in this way, we do not accumulate any negative emotions here and only give and give positivity to others. Just like a candle enlightens another candle, giving away light to others. So also let us take this determined thought today to be positive, peaceful, and to make others also peaceful and positive. Thank you. Om Shanti.
Great. Wow. Thank you so much, Sunita Didi, for this very experiential ease from the actual mental disease or mental health and the experience, the entire experience of feeling the change inside us. You definitely told us very rightly that in this fast moving world, everything has become instant and everything we can get instantly except the mental tips, the instant mental peace. So yes, thank you for the tips. That is breathe in, breathe out, and to be our original identity. And the very favorite one, never give up because the referee has not yet blown the whistle. So it's very motivating, very inspiring. Thank you so much for these beautiful insights. And now I would again invite Dr. Mita Ji Paswal, President APS, to present the Exceptional Global Spiritual Doctor Award on behalf of IMA, APG, and AMS to Rajyogini Dr. Sunita Didi for her exemplary work.
Hello, everybody.
Yes, now you're audible.
Yes.
Yes,
Okay.
fine.
Thank you. Thank you, everybody. And I welcome all of you. Thank you, Dr. BK, Sunita Didi, Rajyogini, for the very excellent lecture. We, from on behalf of IMA Surat, APG India, APS India, and UFO USA, we would like to give you the award, that is Exceptional Global Spiritual Doctor Award. Kindly accept, ma'am, for your this spiritual activity that you are doing nationally and internationally. Thank you for today giving us this peaceful lecture in this COVID situation, where really we need the peaceful mind and to calm and to handle all the our stress by the mental exercises, and that is Raj Yoga. Thank you, ma'am. Please accept this award.
Thank you very much for this honor.
Yeah. Now I request Karishma. We would like to also award uh, Rajyogini BK Kaladidi for his work as USA. She is a director of Peace Village Retreat Center, Brahma Kumaris at USA. She is founder director point of the Life Foundation, New York, USA. We, on behalf of IMA, APG, APS, and UFO, we all like to give you this outstanding global spiritual doctor award. She is a pediatrician. She is doing his peaceful work. Thank you, ma'am, for your kind work for the this peaceful and the mental calmness for all the people in society. Kindly accept this award on behalf of all of us. Thank you, ma'am. Request to collect this award. Kala Didi. Thank you for the joining also with us. I also welcome Dr. Amit Mohan, Dr. Raina, and Dr. Dharmesh Bhai, who has joined from the USA. And also, I welcome all the office bearer of IMA, Dr. Hiral Bhai, Ronak Bhai, office bearer of APG, Dr. Dhiren Bhai, Dr. Ketan Bhai, and Dr. Ajay Jain from the APS, Dr. Sunita Didi, Dr. Kala Didi, and Karishma for the moderating the session. Thank you, everyone.
Thank you so much, ma'am. And yes, thank you that as we have Dr. Kala Didi Younger with us today. She is board certified pediatrician by training and a spiritual teacher by profession. Born and educated in India, her fervor for a new order of human values and well-being is reflected in her dedication to the work of Brahma Kumari's World Spiritual Organization. I would request ma'am to please bless us with her kind words, and it is an honor to have you here.
Thank you, first of all, for this wonderful gathering and, of course, for the honor that you all are giving to spirituality, not just a person or a persons as such, but people who are doing spiritual work. And I really feel that's very, very praiseworthy and worth mentioning and really showing to the world how work that we do in the field of mental health is so connected with spirituality. Of course, we know that spirituality has connection with all the fields of endeavor in the whole world, right? Because everything starts from here and kind of radiates. But of all the fields, I feel this is the one field that's the closest. If we can really marry these two disciplines with understanding and with cooperation and harmony, I feel we can do wonders for the people that are in distress. I also like your topic that you have given me. I just have to bless. I don't have to talk about anything great. It's just about blessings. And, I have been myself thinking about where blessings really come from. Usually we would go to someone great, some, philosophers or spiritual people, religious people, and we would ask them to bless. But in our field of studies and in studying spirituality, blessing has a very unique meaning. And the meaning is really elevating the quality of our thoughts to such a high level that everything that we think and everything that we say and everything that we do for each other becomes a blessing. It becomes a huge lift. And of course, the first person that we all have to bless is our own selves. Right? Have you ever thought of it that we have to not give in to the situation, as Dr. Sunita Didi rightly mentioned? Usually we are bombarded with circumstances, situations, and everything, and we give in. And what we have to do at that time is to remind ourselves of who we are. And this is really a blessing, really reminding myself of who I am, what my abilities and capabilities are. It's really like blessing myself. No, I can do it. I can be peaceful. I can handle this. Just talking to myself in that way. And I think as mental health professionals, as a matter of fact, as health professionals, I feel this is very important. The attitude that we carry into our patient's room or bedside, whatever it may be, is so important, because what we can literally do with medicine, what we can do with our hands, may be very limited, especially given the set of circumstances that we are in today. But what we can do with our vibrations, when we carry those vibrations of positivity, of hope, of faith, of upliftment, of encouragement, of acknowledgement, even, and acceptance, wherever they are, whatever the condition they are in, I think if we can be accepting, that's in itself a big healing force. And I usually, there are many people come to me and, they ask, but if somebody is really disturbed and really not with it, really cannot think right, how can you really help that person spiritually? And I feel that even in those circumstances, if we carry the right vibrations with us, vibrations that we talked about earlier, of peace, of calmness, of reassurance, and most importantly, that of acceptance, I feel, I'm going back to the comment that was made before in terms of the stigma in the society, especially in India, and now, of course, everywhere, stigma in the society for any kind of mental illness. Where did that come about? We're just not able to accept that as people, as human beings, we can go through ups and we can go through downs. And it's okay. Just as the body goes through ups and downs, the psyche can go through that too, because we do live under a lot of pressure. We do live under a lot of stress. We do live with a lot of conflicts, in today's society. And most importantly, the conflict is internal, the conflict of our own value system. So we have enough reason for the psyche to be disturbed, but let's accept it for a fact. And let's also see how we can help that situation, help that person. And I feel, yes, of course, the discipline of mental health, psychiatry, psychoanalysis, very, very analytical and very, progressive, in its own way. But also, I feel, if we can acknowledge certain basic concepts in our daily life, for example, one of the concepts that we work with in spirituality is that love is a very basic energy that we all hold within us. We're all capable of love at some point or other. And if we don't get it, we kind of suffer from it or we look for it. And over a period of time, if we are deprived of it, naturally it ends up in some kind of a mental disorder or whatever. Same thing with peace of mind, same thing with power, mental power, internal power. So if we know that these are our original natural assets that we all come with, and if we are deprived of it, and if something is wrong, then let's see how we can supply it, and how we can supply it is really by acknowledging again, that we, through our own thinking, can create the experience of those qualities within ourselves. So if I don't need, for example, somebody to love me, but I can experience that love is an internal quality. I can have love for myself, just for who I am. And I can also experience the love of the creator, love of the divine, so I don't have to go anywhere else for it. So some of the basic concepts I feel of spirituality match very closely with the healing that we want to bring about, not only on an individual level, but also on at the global level and on the societal level today that we know. So I particularly like, even with that, within the field of mental health, I love the fact that there is so much research that has already happened about positive psychology. It's like preventive psychology almost. It's fine when somebody ends up in trouble and you find out what's wrong and you treat, all of that is fine. But can we create a society that is built on the model of positive psychology? In other words, can we create some kind of a, mental discipline that every day, for example, as we just practiced now, even for 5 minutes, even less than 5 minutes, we have to remind ourselves of our positive qualities, for example, right? And we all have them, something we have. We may not have a whole lot, but we do all have some positive assets. So I believe it comes with our upbringing, definitely, but also not to take it for granted. One of the things that I find, when coming from India into, America, I found was there was a lot of sense of false security, just because of the religious traditions, the faiths that are surrounding us, the society that's very protective and all of us. But when those things are gone, then all of a sudden you end up and say, but what am I? Who am I? What are my values? And then you start experiencing those inner conflicts within yourself. And that's when you really begin to understand, what in reality you are yourself as a human being. So my own journey actually has been very revealing in the sense that let's uncover some of those protective covers of non-acceptance and false security, sense of false security that we have created over a period of time, and really open ourselves to that real discovery of who we are, and therefore also help each other, whether it is our family, whether it is our friends, whether it is somebody that we don't even know, so whether it's our patients, but really open ourselves more to this area of self-discovery, which is very close to what I think mental health physicians and health professionals try to do, really uncover a lot of the fabricated stuff and really find out what's the real being like. So I am very, very happy to not just have good thoughts, good wishes, but I really feel that spirituality has a lot to offer. Rajyoga has a lot to offer. The Brahma Kumaris have a lot to offer. Um, we, for example, in Peace Village hold a lot of retreats and gatherings for health professionals and mental health professionals, as a matter of fact, introducing the subject of self-discovery, vibrational healing, positive psychology. We introduce these subjects to health professionals. And so I think that's the way to go. And regardless of the situations and the circumstances we are going through, as Dr. Sunita Didi rightfully said, we cannot give up, because our basic mental nature is one of health, one of self-respect, one of peacefulness, one of love. And so we have to go back to those original qualities, help each other to discover those qualities, no matter what. And so I commend you for what you're doing today on this Mental Health Day, and really wish for everyone on the program, especially the organizers, I commend them for doing this kind of work, thinking of even doing this kind of work and bringing together so many people to be exposed to what really the society needs today, what we ourselves need today as people who heal others. What is it that we need to uphold and maintain? Obviously, it needs to be in a very, very positively high level of vibration that we have to go to work with. So let's all make that commitment for doing something.
Thank you so much, Dr. Kala Didi. That was very insightful, I'll say, because yes, you rightly said that if we must accept that as body goes up and down, our psyche can also go up and down, and it needs to be acknowledged. That is a very beautiful insight, and we must address to it. And that is what the mental health awareness actually needs. So thank you so much, and we are so glad to have you. Next, to present the concluding remarks of today's webinar, I would like to call Dr. Rupesh Raina, President, AIPNO-USA, who is an adult pediatric kidney disease hypertension nephrologist at Akron Children's Hospital and Akron General Medical Center at Cleveland Clinic Foundation. So, sir, it's an honor to have you. Over to you.
Hello, hi, this is on behalf of Dr. Rupesh Raina. It looks like he might not be able to join. I'm Dr. Dharmesh Mehta. I'm the president-elect for AIPNO. So I'd like to conclude remarks. Thank you so much for having AIPNO as a part of this conversation. And then it was very nice talk, So I would like to thank you, Sunita Didi, and thank you, everyone, for joining the event. Thank you.
Thank you. Thank you so much, sir. And I would also like to invite Dr. Dhiren Patel, President APG India, who is also the member of National Ethics Committee IMA, to present his significant remarks on today's webinar. Dr. Dhiren Patel. Yes, sir, you are unmuted. You can speak. Yes.
Yeah. Thank you for such a nice information by Rajyogini, Brahma Kumari, Sunita Didi, and Rajyogini, Brahma Kumari, Kala Didi. They have given excellent insight about the awareness of the mental health. I think it is very much important. We all focus on physical health, but mental health is equally important. In life, there are very much, ups and downs all the times, but still, you have to tackle this situation all the time. That is very, very important. And for this, you have to stay positive and not give up anytime. That is very important. And what Sunita Didi has explained, you have to follow the spiritual way to bring the mental hygiene and mental health in a proper way. And if you are not getting with the proper result with this, so you can consult psychiatrician also nowadays, because mental problem you cannot ignore, otherwise it will lead more and more problem into your life. So ultimately you can consult psychiatrician for the better treatment, and ultimately you can get best result with them. So with this conclusion, I advise everybody in the good mental health in for this World Mental Health Day celebration. Thank you.
Thank you. Thank you so much, sir. Also, moving ahead with the seminar, we have this question and answer round. So if you have any questions for Dr. Sunita Didi or Dr. Kala Didi, so you can write in the chat box or in the YouTube live session as well, or in the current chat box of our Zoom call. So if any questions like that, we can ask them to answer it for you. So I guess we can just wait for 30 seconds for in case if there are any questions that comes up.
Anybody on Zoom would like to put forth any question? They are also welcome.
So, ma'am, I do have one question. So now that we are okay, we have one question for Dr. Amit Mohan. It's in the chat box. That what resource we have for acute depression and us for emergent years.
Thank you, Dr. Raina, for the question. I think it's a very good question that, especially with pandemic or no pandemic, depression is an illness that is, recognized by WHO as one of the biggest leading source for disability. And in addition to the disability, acute depression, chronic depression, depression of any sort, whether it is situational or not, because a lot of times, when we have stress going on, we always say it's stress. It's stress-induced depression, and I'm fine, I can deal with it. And because a lot of times people feel it's a sign of weakness. It's a sign of like I cannot handle things, I cannot take over things, and I just need to live with it. And people come to an acceptance a lot of times, and they live a subpar life. They come to an acceptance of like this is how my life is going to be. And I think depression needs to be dealt very much like any other medical illnesses, any other physical health issues. Think about like if anybody has any kind of like heart palpitations or you have chest pain, you go to your cardiologist right away. You won't even think once. But if, let's say we had panic attacks because we were so depressed and anxious, do we ever go, we try to hide. You're in a party, you have a panic attack, you'll be like, oh, no, I need to go, I'm not feeling well. Nobody would ever come up and say like, oh, I'm not feeling well because I'm mentally like really feeling down at this time. And I think recognizing is the first step in any treatment is recognition and acceptance. If we recognize and if we accept that this is beyond my control, this is not something that is a sign of weakness, is the first step in treatment. Then there is options. We always recommend people to have good sleep hygiene. Me being a sleep specialist, in addition to a psychiatrist, that's my specialty, and I'm also addiction specialist as well. So a couple of things that I always recommend people, first of all, is good sleep hygiene, making sure you're getting 7 to 8 hours of sleep, making sure you're involved with your loved ones, making sure you're talking about your problems, making sure you're seeking help from counselors, therapists, friends, family members, making sure you're taking time for breaks in your day, not just treating like yourself like a machine that I get up, I go through the session, like I work all day, and not having anything for yourself, developing those activities and taking care of your physical health. Exercise is very important. And despite all of that, if you still struggle, there is help available. We as psychiatrists, we have medications these days that are very effective, that are very good at treating depression. And a lot of times I get a question, people come for me in acute depression, do I have to be on this medication lifelong? And that's always the biggest question which people struggle with. And I said, like, you have to think about this like diabetes, like hypertension. If you had that and your doctor said you needed to be on antihypertensives or insulin or any medications for diabetes, would you ask them, like, do I have to be on? Yes, you will. But if they tell you yes, you have to, absolutely you have to. But why question about a medication for mental health? It's not about, and you have the right to question, but also acceptance. Like, if I have to take something for lifelong, I will commit myself. But I always tell, like physical health, mental health works the same way. If you have hypertension, you exercise regularly, you decrease your salt intake, you decrease your weight, you do all the positive things, your needs for medication decrease. The same thing in mental health, we tell, like, make sure you exercise, make sure you see a counselor, make sure you spend time, make sure you relax, make sure you have fun things involved for yourself. And then, yes, there is a possibility that one, we can treat depression much faster. Two, we can also avoid people being on medications long term. And that's what I would be my course of treatment.
Thank you, Dr. Mohan. Sorry, there were some technical issues which I couldn't be able to unmute myself. So this is Dr. Raina from US, and just want to thank you all for giving us this opportunity to AIPNO, and special thanks to Dr. Sunita Didi and Dr. Amit Mohan for orchestrating it. I have one more question which I put in there, which I'll put it more in a vocal form rather than a chat form, is people always comes and ask us about the deep breathing exercise. And that's a question for Dr. Sunita Didi, maybe for Dr. Kala Didi and Dr. Amit Mohan. I want both the spiritual and the medical answer for how to control the body, mind, intellect via deep breathing exercise for acute anxiety.
I think it would be appreciable if we have Dr. Kala Didi to first reflect upon this, because she has an appointment also elsewhere. Yes, Dr. Kala Didi. Please unmute yourself.
Yes, I definitely would second the deep breathing exercise. And recently I actually was at a conference, and they are saying that the breathing out is even more important than breathing in. So as a matter of fact, breathe out before you can even breathe in, so because it has to do with the sympathetic and parasympathetic. So we know that, the breathing out is more to do with the parasympathetic. And so you want to really activate the parasympathetic a little bit more. But we know that, breathing centers are very closely connected with our nervous system, right? So it's an involuntary thing that happens, but we can also do it voluntarily. That, and especially when somebody is going through an anxiety attack, that's probably the best time to actually do the breathing exercise, because it's actually activating the parasympathetic system. And so it's almost like an involuntary message that the brain gets, it's okay, you can relax, you don't have to do the thinking, but the breathing is actually activating the right kind of thinking, in these circumstances. And I feel that it's very effective. Also, they say a lot about, mouth breathing and nasal breathing. Nasal breathing is our normal way of breathing. So anytime we do breathe through the mouth, it's actually giving a message to the brain that there is something, danger already in the air, because it's a dangerous way of breathing. So also to make sure that if we are really anxious about anything, and we are, panting for breath, or we're, breathing through the mouth, then we have to remind ourselves, no, there's nothing to do that. And we come back to that nasal breathing more. And so I think that we can't say enough about breathing. We have kind of underestimated the value of breathing for a long time. And it's now time to go back to the right kind of breathing. But breathing also with awareness is something I believe very strongly. just breathing normally with awareness is very, very important because it's actually reinforcing the life force in the body rather than taking it for granted. It's actually validating life. It's a very positive, way of acknowledging your own self. And so I'd like to maybe pass it on to Dr. Mohan or whoever else wants to follow.
Thank you. Thank you so much, Dr. Kala Didi. So yes, we have our next question for Sunita Didi, that how much we can practice Raj Yoga in daily business schedule. So daily busy schedule may how we can actually implement or practice Raj Yoga. So this is the question.
Yes. So in daily busy schedule, in order to practice Rajyoga, it's very important that.
Ma'am, your voice is a little less audible. The volume is less.
Actually, I was muted, I think. So in normal daily routine, it's like Raj Yoga you can practice 24/7. Any time of the day, anywhere. It's so simple, it's so easy. Anyone can do it, even a small child, even a person who is a patient on lying on the bed also, he can do it. So, we can do it 24/7. And if we do it 24/7, of course, we are going to be blessed with so much of positivity. Well, but if not 24/7, at least before going to sleep at night, it's very, very important to practice Rajyoga meditation. Because it's at night that our subconscious is continuously working. The conscious mind is at rest, but the subconscious mind is continuously working. And so when we are, before going to sleep, when we are practicing Raj Yoga meditation and we are doing these breathing exercises, and when we are focused on our original identity of being at peace and connected with the Supreme, then sleep is also very, very good, healthy, sound sleep. And the subconscious mind throughout the night is also working on our this innate qualities of peace and positivity. And then that refreshes the mind when we wake up in the morning. So one is before going to sleep at night, and the other is as soon as we wake up in the morning, the first thought, if we just sit and have that first thought of who I am, my original identity, and if we connect with the God, our supreme power, then it is said that like the first face you see in the morning and your whole day will be according to that. So it's like the first face we see of our own self, very positive face, and of our God Father. So then that lays the foundation for the entire day, and it's like setting up an automatic machine. It's just a washing machine when you set up. Like for 30 minutes, then you do your work. So in the early morning, you just set up for the entire day, you plan out your thoughts and make it a priority that I want to be at peace before I start doing any other work. And then throughout the day, if you can do it for 1 minute every hour, we have a B Zone app, which you may install on your mobile, and that will be every 1 minute for every hour, and that will remind you that step back and be yourself. Take a break and be yourself, and in like that you can meditate. And these small steps will help you to be then in a meditative state, even while doing every activity. And yes, while drinking water and while eating food, these two things, if we consciously choose to be who we are and drink water, that will have effect on the water. And that water has effect on our body, because 70% of our body is made up of water. And the food also has effect on our body as well as on our mind. It said, as the food, so is the mind. So if we eat the food also, and as the mind, so that vibration will reflect in the food. So if we eat the food in a very positive state of mind, then that will also empower our mind positively. Yes, thank you so much.
Yeah. One more question, Karishma. Yeah.
Yes.
Sunita Didi, yeah. We have a meditation every hour in between for the 1 minute. We have to thought, or the which thought are running in our mind have to flow the thoughts. Yeah, we have to thought like I am a pure soul, I am a powerful soul, like that. Or you have to flow which are the आपके मन में जो विचार चल रहे हैं उसको ही चलने देना है या ये थॉट लेना है. That is every hourly. That is
Yes.
big.
We may choose a particular thought.
Yeah.
What we do is early in the morning when we wake up, just as we plan out our day, like what are we are going to do throughout the day, what meetings we have and everything, we prepare a to-do list. We also prepare a to-be list. That, okay, at this hour, I will be at my, say, the quality of being at peace. And at this hour, I will experience love. At this hour, I'll experience bliss. At this hour, I'll experience that happiness. So if we set our timetable for our mind, then that particular hour, it's very easy to choose that thought and work upon it, experience it, and feel it. So then we can give our mind a direction also based on the goal that we have set. Thank you.
Thank you. Thank you so much, Dr. Sunita Didi. Also, we will have the last question now. Last question is for Dr. Amit Mohan. It is that at what point, at what stage do medical intervention shall come in when it is related to mental health or mental illness? So at what stage someone should go and consult a medical professional when they are facing through some kind of mental illness?
I think that's there's a fine line how and when you approach and go seek a psychiatrist and seek mental health. The most important, like I said, is first we try interventions that are basic interventions like good sleep, good hygiene, exercise, cutting down alcohol, cutting down if you smoke cigarettes, removing all drugs, removing all the bad influences from your life, and trying to work through your stressors. But for us, if the symptoms are persistent for 2 to 4 weeks and they are not improving, and you have been struggling with symptoms, and you feel it's the quality of life is one of the big things we look at. Like if I'm sad, if I had a loss and I'm sad, it's natural, right? Everybody gets sad when you have a loss, when you have something stressful going on, you will be anxious because that is your body and your brain's natural response to those particular situations. But if the response still persists and the response is affecting your quality of life, it's affecting your relationships, it's affecting your ability to enjoy things, it's coming in the way that you feel like life is not worth living. You don't have to get to those points. You don't have to struggle like that, because anytime you get to those points where daily things become a chore, where everything becomes like, oh my God, how do I get about doing this? How am I going to be able to get through the next day? How am I going to be able to get through my next moment in my life? When that's affected, when you're getting irritable, you're getting upset with your loved ones, when you are realizing that your life is falling apart and it's not going how you should be, and you are losing your sense of self-control, I think those are important things to remember, and those are important things where you should seek intervention early, because the longer depression persists, the studies have shown that it tends to also cause long-term damage to your brain. You're losing your brain neurons, and the depression becomes more chronic, and multiple meds are needed at that point. And that is what we need to avoid, because your chances of responding and getting off the medication is highest if you have a good 1 year of stability and you can go and get your symptoms treated early on. And I think the breathing exercises, I would echo that, that sentiment, like they are so important. And not like, yes, this is our yoga, this is our culture, this is what we grew up with. Along the way, we lost some of that. And now the Western culture, the Western science is accepting it, because not only it is what we know that helps, but there's actual brain changes that help in your frontal lobes. And your frontal lobes are your CEO of your brain, which is what organizes, which is what helps you plan, which is what helps you experience pleasure, joy, execution. All that stuff is done with your frontal lobes. And people who do these exercises on a regular basis, they say they're seeing a lot more frontal lobe activity, which is again, resulting in better mood, better focus, better attention, better memory, better ability to do things. Those are important things to really, really remember, and think about brain as a muscle. Brain is like, people when they work out and they develop all these huge muscles and bodies and they go for all these things, they don't develop that in a day. They work out every single day. They work out, they eat healthy, they do all these exercises over and over again. And to develop our brain muscle, we have to do the same things. We have to do, meditation every day. We have to make it a practice. Like we eat, like we sleep, we meditate. And that will lead to a lot better outcomes in our lives and a sense of happiness and living a very good quality of life.
Yes, definitely. Thank you so much, sir. Thank you for that answer. And thank you so much for answering all the questions to all the panelists here. Also, talking and speaking about mental health and mental well-being and mental toughness, the very important and crucial ritual that we must practice is also gratitude. And gratitude is the best practice. And thank you are the two sweetest sounding words that we can listen and we can accept and we can give to somebody. So now I would like to invite Dr. Ajay Jain, Secretary.
1 minute, Karishma, 1 minute. One question for the Amit Bhai. Yeah, there is a very fine line between the when to medication start in a psychologically disturbed patients. I think we can go for the meditation and medication together. And the difference between the patient having anxiety disorder and depression, the difference of the advice.
So anxiety is a normal response to our, any kind of situation, any kind of stress. If we don't have anxiety, I always tell people, you will not do anything. You'll lay there, you will sit all day, you will just be like calm. Anxiety is the drive of our life. Anxiety is what gets up, what gets us going, what gets us functioning, what gets us. But anxiety, when it becomes a disorder, that's when we tell people to seek treatment. Because a disorder, like, anxiety is a norm, but anxiety disorders are not normal. Anxiety disorders are when, because of your anxiety, again, you are isolating, you are avoiding going out, you are avoiding doing things, you are constantly living in the fear, a sense of something bad is going to happen, catastrophe is going to happen, what if this, what if that. Constantly your mind is racing. You're not able to sleep because at night your mind just goes on and on and on, and you just think about one thing to next thing to next thing. And what we call them as racing thoughts or ruminating thoughts. If that's becoming a problem, if you're constantly, instead of being present in the moment, you are in your own thought process, which lets you get disconnected from what's happening in your right now, in your present. And either you're living in the future, which is what anxiety does. Because anxiety is a lot of what ifs, what if this, what if that. So that is what we live in the future rather than living in the present, in the moment of what's going on. And what does depression does? Depression also makes you live a lot in the past because you're sad. You think about all the bad that has happened, or you think about your life is not going well. So we can differentiate a little bit between depression and anxiety, but they are so intertwined with each other. When you're depressed, you tend to be more fearful, you tend to be more anxious. And when you're anxious, you tend to be more sad because it's very hard to enjoy things. It's very hard to find pleasure in things. And I always tell people, like, they are very intertwined. And, if you have both, we can treat both with similar kind of medication and meditation, because meditation not only helps with just the depression, sadness, but it also helps a lot with anxiety. Because your frontal lobes are the one I talked about. This is what put brakes on your amygdala. Amygdala is your center in your brain that causes you to be anxious when nothing is going on. The original amygdala, which was how it came into existence as your brain was developing, was your fight and flight response. When we were, like, the whole evolution of human beings happened, all the reptilians, all the animals, humans, they all lived in jungles, they all lived out when there was so much danger. So your amygdala was there for that you can respond, you can have the fight or flight response. But as we moved into this Western society, we moved into houses, we moved into all these things, we don't have the same dangers anymore. We don't have animals coming to attack you. We don't have all these things anymore. But our normal life stressors have now become those animals, those dangers in our life. And that is what is triggering our amygdala as a smoke detector thing in your brain, which is just firing nonstop. So eliminating stress, getting your meditation, taking the medications, seeking the therapy and help will help potentiate your frontal lobe so you can, put the brakes on some of the amygdala from firing too much and causing you all the distress and anxiety.
Yes. Yeah. Thank you, sir. Thank you, sir.
Thank you so much, sir. Yes. So yes, now I would like to invite Dr. Jay Jain, Secretary APS India, who is working as sole consultant endocrinologist and diabetologist in Surat since 2003, to present vote of thanks for today's webinar.
Unmute.
Yeah.
Unmute.
Thank you for inviting me. I am very honored and very humbled to listen the talk of Sunita Madam. I am very thankful to Dhiren Bhai, Mita Madam, Dr. Mohan, who has joined from USA. I think this is a very great problem, and in this COVID time also, we are suffering, and our children's also I am seeing that they are having slightly aggressive behavior. I think with this talk and such type of seminar, I think everybody will be get benefited. Thank you. I want to say thank you for this. Can you comment something on how we should tackle our children's with these problems, because they are so much worried for their career? So how we can tackle? I only want to get answer of this question.
Yes.
Is it for me?
I think we can. I want to add one more question with this, and how to get I think minimize the use of the technology like mobile and other things for the children also. And we want answer from Dr. Amit Bhai. Amit Mohan, please.
Yeah, for I think those are very good questions, which I think all of us are struggling. We're in the same boat. And I can tell you have a 4-year-old nephew who's 4.5 now. And, I see him attached to his iPad like so much that, even at those ages, they're faster than us in operating and like finding these things and doing these things, because our life so much has run around technology, and everything is like we're all sitting on phones. We're having dinners, we have our phones in our hand. We're talking to somebody, we have our phone. We go to our meetings, we're checking our phone. And I think it's the dependence that what has happened over as we are evolving with the technology is what we have to realize. And our kids emulate our behaviors. So who doesn't tell their kids to do the right thing? We all tell our kids to study, be a good human being, be nice to each other, be a kind person, do all these right things. But what children pick up on is not what we tell them, but what we do. If we start making a change in ourselves, I think that is the first step where the change happens in kids and where the children actually see a change in behaviors. If we start making it a point that nobody, even when we're having dinner, that nobody's going to sit with their phone, everybody's going to put their phone away. Or if we're watching a show on TV, if we're doing activities together, nobody's allowed to do. I think that, and then restricting what from a sleep perspective and a psychiatry perspective, what we have figured out in the research is like restricting the screen time to no more than 2 hours a day for kids is shown to be more appropriate, because anything more than that is actually causing a lot more attention deficit, a lot more anxiety, a lot more stress in kids. And another thing that happens with the use of these technologies is kids have the freedom to now explore and see the things that they were not exposed to before, because as we were growing up, we were playing outside. We had no exposure, but when you are using these screens, when you're using this TV, when you're using all these things, it just exposes you to a lot of fears, a lot of anxieties, a lot of insecurities. You're comparing yourself, like Facebook, all these social media websites, all they're creating is a sense of insecurity. And so restricting the time is one of the big things. The second thing is what we do. The third thing is spending time with our kids. It's huge, because we get so busy with our lives that we are run all the time that we don't realize that they are going to these things because we don't have time for them. We haven't even, other than asking them to study, other than asking them to do well in their career, have we spent time with them? Do we really know our kids? As a big thing, because a lot of times the thing happens is we don't even know what our kids are or who our kids are at times, because lives have become so busy and stressful for all of us. And I think, again, getting them good sleep from beginning and teaching, yoga, teaching meditation, teaching those things early on will bring a positive change. helping them, take them out back in the nature, take them out back in like, fresh air, having them play outside, having them do more of those activities will help. And on top of it, taking away the stress. Like, don't put stress on them, let them be. And they will be good kids because, once we do good, they will do good.
Definitely. Thank you so much, sir. Those were really very meaningful insights that actually students or children do learn by seeing what they are seeing at their home. So yes, it's very important to
Thank you. Yeah.
change within and to change our actions so that we can change the lifestyle and the life that we are giving to our children. Very, very rightly said. Thank you so much, all of you, for coming here and making this webinar very successful. Thank you, Dr. Sunita Didi, for giving me this opportunity.
Any special comments? Any
be here
special
among so many
from Sunita
professionals
Didi?
together. Yes, so it's a great opportunity to come here and listen to all these meaningful, insightful knowledge that I've got today. Thank you so much, all of you. Have a great day and good night to people who are in India, and a very good day to people who are abroad. So yes, thank you so much. Thank you so much, everybody.
Thank you for having us.
Thank you, everyone. Bye-bye. Thank you, Dr.
everyone.
Amit and Dr. Rupesh. Yeah, thank you.
Thank you. Thanks a lot.
Bye-bye.
Thank you, everybody, for being here. And thank you, Sunita Didi. Om Shanti.
Om Shanti, Sunita Didi and
Om
Kala
Shanti.
Didi.
Good
Thank
night
you.
and good
Good
morning,
night.
USA.
Yes.
Yeah.
Thank Karishma for such a good moderation. Yes.
Yeah.
Yes.
Karishma, beautifully moderated. And thank
Thank you, Sunita Didi. Thank you so much.
Dr. Kala Didi from USA. And thank you, Dr. Dhiren ji, Dr. Mita ji, Dr. Hiral ji from India for organizing such a great webinar. Om
Thank you, everyone. Om Shanti.
Om Shanti.
Let's thank God also. And thank
Thank
everyone
God. Yes.
who have joined. Yes. And in future also they will be joining because this is going to be there on YouTube forever. Om Shanti. Thank you, Mita.
Thank you. Thank you, Kala Didi. Kala Didi is there.
Yogesh Desai has joined. Who is Yogesh Desai?